Okay, so you want to know what the best PA school is in the entire country. It is the university of whatever the cheapest program is that you can get into. That's what your aim should be, paying the least amount of money as possible for school. Hi, everybody. I know it's been a while, so we always say this every year, we're going to try to get our podcast going back up and running. So here's our first one of 2026. So probably a little late on the Happy New Year. But anyway, my name is James, and I'm a physician assistant for any of you who have not seen this podcast before. But today we're going to talk about picking PA programs because there is a lot that goes into it. And unfortunately, a lot of things that students use typically to pick PA schools, usually not always the best choices. So let's see if we can clear some of that up today. Just for a little background, I went to Stanford University. And for those of you who think, well, look, you went to Stanford, so obviously name recognition is really important. So I need to go to a top PA school or top name PA school as well. It's not. And this is not why I chose Stanford. Stanford, a long time ago, believe it or not, was a very short program. It was actually only 16 months. Yeah, this was a long time ago. And it was one of the cheapest programs out there. I'm not going to get into how much it cost, but let's just say that when I graduated, I didn't have any debt. I was able to pay it when I attended. So that's why I chose Stanford. But for those of you who are thinking, I have to go to this big name school, and there are many of them out there. And I see this routinely year after year with our students who are applying. They're looking at the big names like Duke because it is the first PA school. Well, let me tell you something a little funny. If you ever wonder about this too, check this with the doctor that you work with. A lot of students know that Duke is the first PA program. However, you know who doesn't know that? The doctor. The doctor that's going to hire you. You may find a few doctors that know that, but the point I'm trying to get across is nobody cares that it's the first PA program. So if that's your thought or reason, it's like, oh, I want so badly to go to Duke, nobody's going to know, that it was the first PA program, and it's not going to have any impact on getting hired or what you'll earn. But students, routinely they're looking at schools like Yale. They look at Stanford, look at USC. They look at Northeastern, Northwestern, Boston University, Cornell, Emory. And I can go on. So if you're not aware, there are 338 PA programs out there, at least our last count. And again, as I said in the beginning, it's sort of funny, but it's actually not a joke. The best PA program is the cheapest one. And why do we say this? Obviously, at some point, you will have to pay this all back, just like your student loan from undergrad. And when you're looking at PA programs, if you've done some research, you might know there is a huge disparity in price amongst PA schools. I can't really honestly say what the average is. We've never actually put that together. But there are schools that are there are some schools that are $100,000 more than other programs. There are some that are even more. Like there is a school in Texas, and if you're a Texas resident, it's about $37,000. Whereas if you went to University of Southern California, USC, it's over $205,000. So we're talking $170,000, roughly $170,000 difference. I know when you're going to college for undergrad, name has some benefit, or there is something to the name recognition, clearly the education that you receive. But if you're pursuing some other career where you attended undergrad is going to have an impact on that next step, obviously where you went to undergrad is going to have an impact. But for PA, and even for doctors, where you attend PA school, and same for doctors where they attended medical school, has really almost nothing to do with getting a job and how much you're going to get paid. Let's talk about the payment, because I really feel very strongly about this and feel students need to understand and recognize this. Going to PA school is not like going to law school or becoming an engineer or getting your MBA. For those career paths, it would have an impact, meaning if you went to a really good law school, probably work for a big firm, and you would, your earning potential would be much more than, say, if you went to a much smaller or lesser known law school. For physician assistant, PA school, it does not work that way. If you're not aware, just please talk to the doctors that you work with and ask them what you're going to earn as a PA has to do with what the insurance companies will pay. All of your services, everything that you do, whether it's seeing a patient, it's rounding on patients in the hospital, outpatient in a clinic, it is assisting in surgery, whatever you're going to do as a physician assistant will be, the payment will be based upon what the insurance company is willing to reimburse. And then if you want to make it even a little bit more complicated, most insurance companies go off of Medicare. So Medicare is kind of the standard. Depending upon the insurance company, the specialty, what you're doing, generally the insurance company is going to pay a little bit more than what Medicare does. One thing that never ever goes into consideration as to what they're going to pay you for your services is where you went to school. For any of you that work in a clinic, and if you have dealt with prior authorizations, if you've done coding, if you've done any of the little billing, if you've been involved in that at all, and if not, maybe talk to people in your office, but ask them, I'm kind of being facetious here, but ask them if there's a code for where the doctor attended school. And I already know the answer, which is no, there's nothing. So again, the insurance companies, they don't care. They don't want to know where you went to school. And even if they did, they'll never impact. But this is how you're going to make your money. So I mentioned a couple of schools earlier and the disparity between the cost of those schools. So when you graduate, you decide to go to this big name school, you're going to owe, obviously, the loan that you took out to attend school. Again, you're going to have this enormous student loan payment. So at some point, you're going to talk to one of your colleagues who went to a smaller school, maybe even one that you've never even heard of. Like I said, there are 338 programs. So there are many, I'm sure, that you have never heard of. You're going to find out that your colleague who went to, like I said, a lesser known school, paid a lot less, and makes the same amount of money as you. Because again, the reimbursement will be based upon what the insurance companies will pay. I'm sure I sound like a broken record, but it is something that I hope students will really take into account. As I said, we work with students. If you're not familiar with our services, we work with pre-PA students, getting them into a PA school. And part of it is picking out a list of schools that would be a best fit for students. Regularly, I have students who they go off of name recognition, a lot of times location, and never really looking at price. I do have some students, fortunately, that is their number one priority is cost, which is great. But for most students, it's a lot of name. I have students who often their family is pressuring them. Maybe you're first in the family to pursue a career in medicine, or maybe it's just your family's background, just growing up knowing that the big name schools, thinking this will have an impact. And as I've already stated, it would if you were to pursue other careers. Again, getting your MBA, big name school is important, law school, and there are other career professions, but it just doesn't work this way in medicine. You could always talk to one of the doctors if you work directly with a doctor, if you encounter them in your work. Ask them if where they went to medical school, if that had anything to do with their ability to find a job or what they're currently earning. For doctors, it's not the medical school. It generally is the residency that they did. And again, the residency, it's not so much the name recognition. It's just that, some residency programs are a little bit better for certain specialties. But for a physician assistant, most do an informal residency. There are some formal residency programs, and I'll tell you what, I'll do a podcast on that either this month or next month, talk about differences between doing a formal residency and not. Sticking to what we're talking about, picking the best PA school. When you graduate and you go out and start doing an informal residency, which just essentially is the physician hiring you and sort of, if you want to call it, training on the job. I currently practice neurosurgery. At one point, there were about 17 surgeons that I used to assist in surgery. I'm not too bad at what I do in terms of neurosurgery, being a physician assistant, but it had nothing to do with me going to Stanford. I never even learned anything about neurosurgery other than there was a specialty called neurosurgery and how to write a consult for neurosurgery. But I didn't learn anything about neurosurgery. The reason why I'm good at what I do is because of the doctors who have trained me. So that's why I get hired. It has nothing to do with going to Stanford. In fact, the doctor that I currently work with, he doesn't even know where I went to school and definitely does not care. So again, I'm trying really hard to let you know that it sounds like a terrible thing to say, go to the cheapest program that you can. But later, you're really going to appreciate this. As I said earlier, you meet somebody and find out, somebody else went to a school that cost a lot less, owes a lot less money, and you find out you're actually earning the same amount as somebody who went to a school you have never even heard of, and you invested in going to a top name school or a recognizable name. This does not mean that every big school or well-known name school is excessively expensive. There are many of these PA programs that are not overly expensive, even though they are a well-known name school. Other things to consider when you're looking at schools, if you are not aware of, last November of 2025, the Department of Education came out and said that they are proposing to make this change that says PA, physician assistant, is not a profession. And what this really means is it's going to impact borrowing money for a student loan. Now, just to be clear, the proposal that the DOE set forth has not been made official, and it impacts nurses. So hopefully they're going to, well, I know they are fighting it, and hopefully this will never even come about. But if they were to actually change that, essentially this will impact your ability to borrow money at a lower rate. Just to be clear, no matter what, you will be able to borrow money. It's just that the amount the federal government, will subsidize or allow you to borrow, it's going to be capped and probably a lot lower if they do pass this new thing saying that PAs are not a profession. You'll still be able to get a private loan, just now this is going to be a much higher rate than what the federal government can offer. So again, you'll be looking at paying back more money if that's what happens. So for that reason and others, just trying to find programs that are the most affordable, most economical. Now, I do know for some students, sometimes picking out a top tier program or really well-known school with name recognition really isn't because of the name recognition, but more that the school is close to home, and in that sense they would save money on living at home, even though it is a more expensive school. And that makes perfect sense. We have students that do this quite often, or generally every year we have students that are in that position. And certainly, as I'm saying, that makes sense. Picking a school that is maybe a little bit more on the pricier side, but you'd be able to live at home and save money that way. That's a great idea. Okay, so I've talked a lot about looking for that inexpensive school. So how do you do this? I do have students that I work with that come from a medical family. I had one last year. I spoke to the student's father, who is also a doctor. And the first thing he said to me was, please convince her it does not matter where she goes to school. And again, this is the truth. If you talk to other healthcare professionals, again, if you work around or with a doctor, ask them their thoughts on the name of a medical school, if that really has anything to do with, again, being hired or what you're going to potentially earn as a PA. Finding that school that is not as expensive. Well, in-state tuition, that's going to be a huge thing. So depending upon where you live, I'm not saying that every state offers very inexpensive PA programs, but look at the programs that are in your state. Generally speaking, the schools that are in your state are going to be preferable for the PA program. Again, Very different from medical school. When doctors are picking out med school, or I should say, when the medical school is looking at a candidate, they're not really fixated on where that person is from, because all likelihood is once that doctor graduates, then goes on to do a residency, the odds of the residency being at that school or maybe even in that state are, I don't know, probably slim. And so they have no expectation that the doctor, after they graduate medical school, that they're going to remain and continue to practice in that area. For physician assistant, after you graduate, most don't do a residency. Most just start working and get trained on the job. So because of that, schools are looking more for people who are local. We all talk about the shortage of healthcare professionals. Students routinely like to talk about how PAs fill a gap in healthcare because of the lack of healthcare professionals, healthcare providers, doctors. But unfortunately, if you're going to I live in Texas. If you were to go to school here in Texas, but then say you're from Florida or you're from Indiana, after finishing school, if you plan on going right back to Florida or Indiana or wherever you originally came from, this really doesn't help for the schools are trying to make up for this gap, in terms of healthcare professionals and the need for more providers in that local area. So a lot of schools are looking for students that come from the local area, if not at least the same state. That being said, there are many, many programs that where you live really has no impact on their decision to pick a candidate for an interview and ultimately grant acceptance. But take that into account. Again, everybody likes to talk about filling these gaps, but if you're going to school in a different state, that's sometimes a little more challenging. I say sometimes. Again, it just depends upon the school or the program that you're actually picking. For most schools, they do have in-state tuition prices and then out-of-state tuition prices. And obviously, if you're looking at the programs in your state, generally speaking, you're going to be at an advantage of being able to take advantage of a lower tuition rate. Now, if your school does not offer that, there are programs that still, even out of state tuition, they do have some that are fairly low. If you're applying and maybe you have a little on the lower end in terms of your stats, meaning maybe a lower GPA, not as many hours, or there are certain things that you feel make you not as competitive, or maybe if you have tried multiple times, granted, any PA program is a great PA program. There are, as I keep saying, over 300 PA programs out there. And what I tried to talk about earlier is what you become as a PA is going to be more about where you end up working, the doctor who trains you. It's not going to be so much that you went to school. So whether you go to Stanford or you go to USC or you go to Yale or you go to Duke, or again, some of these well-known name PA programs, or you go to something like Larkin or Ottawa or Mercyhurst or other schools that I can name that you may not have ever heard of. Again, it will never make a difference, but what you're going to end up paying back in the long run. I would suggest that either when you're looking at schools, if you're able to be picky, I guess is the word, in terms of the schools that you can apply to, maybe do yourself a favor and go on to just search for a student loan calculator and try to estimate that cost, because on average, you're probably going to be looking at about $1,500 a month in a student loan payment. And I know plenty of students are actually paying far more than that. And when you begin working, I've seen videos about this. It's actually kind of funny to listen to some students who have graduated over the past few years. And then they talk about how much they earned, and then after taxes, then after the student loan payment, what they're actually left with. And it may be surprising to learn, what that is. It's not that you are not going to make a good salary and a good living as a physician assistant, but I always find these students who are picking these schools because of the name, And then ultimately, later, when they have to pay this back, they're just burdened with this massive student debt that really did nothing in terms of finding a job or what they potentially will earn. There is a school that this current cycle, which is not over, I know they had over 5,000 applications. 4 of my students live in the area, live in the city where the school is at. Of the 4, every one of them had over a 3.9. A couple of them, I think, were 4.0s. And out of those 4, only one of them was interviewed at this one school, which happens to be one of these name schools that just people go because the name, and it's very expensive. All right, so how do you pick a school? All right, well, if you have not been to our website, it is pamentoronline.com. And on the website, right on the homepage, it says PA Program Search. As of now, I believe we have all the schools that are currently going to be accepting applications this current cycle. So there are many ways you can search. You can just go to state and you can click as many as you want. Try to find the programs that are in your area. Once you have found once you come to the, say, state that you're interested in, you just click on the show me part and it'll bring up the schools. Once you've looked at the schools, you can actually just click on a school, and listed in here are things such as the GPA requirements, the prereqs that you need to have. We have the actual courses listed. It'll talk about grade conditions, meaning here you have to have at least a C or better. There's some other information, some of it we were able to find, some not. Talks about here about how long your prereqs can be in terms of, here it says they can't be more than 7 years. 7 years could not have passed by the time you applied since you took your coursework. Say if you took anatomy back in, 2018, it would no longer be valid because the school only allows for 7 years. You can see how many hours you need, if you need any shadowing, what evaluations, your letters of rec that need to be submitted, whether or not that need the GRE, if you need to take the PA CAT or CASPER, and what their policy is on international students. So this is all available right here through the PA Program Search database on our website. You can also set certain parameters, like you could ask it to narrow down the schools that don't require the GRE. So here it says there's only 4. You could also go under prerequisites, and if you're concerned about your coursework, you could just ask it to look for schools that either have like a 10-year limit or no limit. You can exclude certain courses, like let's say that I didn't take a second biology. So if I took away the second biology, it'll tell me what school. So there are a lot of different filters that you can apply trying to narrow down schools that fit what you're looking for. That's a tool that we offer in terms of helping students out and trying to determine what schools might be better fit for you. And then, of course, we'll help you. So if you are not familiar with our services, please just take a look on our website, and it explains what we offer. We do offer a free consultation, and the consultation is just to answer any of your questions about the services that we provide. Sorry, we don't provide any advice during the free consultation, so just to be clear. But if you had questions about how the services run, but if you're to work with us, we have a package plan where we'll work with you until you start the whole process, until you actually get into PA school, and during that we will help you pick out the right schools. There are many factors I've talked about, the cost, where you live. I've mentioned that we do have a database, but there are still other factors that are just kind of, we just know. So, for instance, there are certain schools based upon where you live just are not going to pick you, whether it is a certain state if you don't live there, or some schools if you don't live within, say, like a 90-mile radius. Not all of that is right on the PA program database. It's just something that, from having done this for over 20 years, we just know. We did put out a post a couple of weeks ago. We talked about our students. So if you're not, like I said, if you're not aware of what we do, for the last cycle, which started for the current cycle, which started June 1st of 2025, we have 417 students who've been interviewed and accepted. Everything from, we had one student who had a 2.71 all the way up to 4.0 students. So if you do want to learn more about our services and just have questions, go to the website, pamentoronline.com, and sign up for the free consultation, and we'll schedule a phone call with you, with one of the mentors. And they'll explain or answer any questions you have. We'll explain what the services are and then answer your questions related to the services. If you're ready to get started, now is the time. I mean, it's the middle of January. The new cycle will open on April 30th of this year, 2026. If you're just not sure what to do, like I said, go ahead and sign up for the free consult. But if you're ready to get moving, go ahead and go to our website and sign up for the services. We're ready to meet with students this week or whenever you sign up. So I hope this was helpful. It's kind of a real quick down and dirty about PA schools and sort of like some of the unknown things are not well talked about, especially pertaining to cost. So again, I hope this was helpful. And for any other questions, just like I said, go ahead and sign up for the free consultation. But good luck to everybody that's going to be applying this next cycle. Thank you.